Post-traumatic stress disorder (PTSD) is a mental health condition that can develop after exposure to a traumatic event. The condition can cause intense feelings of anxiety, depression, and fear, and can also lead to physical symptoms such as headaches, dizziness, and insomnia. It is a complex condition that can impact individuals in different ways, but it is most commonly associated with exposure to traumatic events such as combat, sexual assault, or a natural disaster. Be sure to watch until the end because there are a few that I think will surprise you. So if you are ready, let's start our topic. Symptoms of PTSD. It can vary in severity and frequency, but the most common symptoms include re-experiencing the traumatic event through nightmares or flashbacks, avoidance of reminders of the traumatic event, negative changes in thoughts and feelings, increased arousal, such as difficulty sleeping or irritability. It is important to note that everyone experiences PTSD differently, and not all individuals with PTSD will experience all of these symptoms. Causes of PTSD. The exact causes of PTSD are not yet fully understood, but it is believed that a combination of psychological, genetic, and environmental factors can contribute to the development of the condition. Some of the factors that have been identified as contributing to the development of PTSD include exposure to a traumatic event, inherited genetic factors, childhood trauma or abuse, lack of social support after the traumatic event, substance abuse or addiction, treatments for PTSD. Some of the most common treatment options for PTSD include cognitive behavioral therapy, CBT, exposure therapy, eye movement desensitization and reprocessing, EMDR, medications such as anti-anxiety medications and antidepressants. It is important to work with a mental health professional to determine the best treatment plan for your individual needs. So what is the impact of PTSD on relationships? PTSD can have a significant impact on relationships. It can cause individuals with PTSD to withdraw from loved ones, become irritable or angry, and have difficulty trusting others. This can create tension and strain in relationships and make it challenging to maintain healthy and positive connections. 1. Communication is key. Open and honest communication is key in navigating relationships with PTSD. It is important for both partners to discuss their feelings, needs, and experiences related to PTSD. This can help both partners understand each other better and build a stronger and more supportive relationship. 2. Setting boundaries. Setting boundaries is also important in relationships with PTSD. This means identifying and communicating what is and isn't acceptable in the relationship, such as physical or emotional triggers. This can help individuals with PTSD feel safe and secure and allow their partners to understand their needs better. 3. Seeking support. In addition to open communication and boundary setting, seeking support from outside sources can be beneficial in navigating relationships with PTSD. 4. The importance of self-care. This includes taking care of one's physical and emotional well-being, such as engaging in regular exercise, practicing mindfulness, and getting enough sleep. 5. Building trust. It is a critical aspect of relationships. Trust can be disrupted by past traumatic experiences, and it can take time to rebuild. 6. Embracing vulnerability. This means being open and honest about one's experiences, feelings, and needs, even when it may be difficult or uncomfortable. By embracing vulnerability, individuals can deepen their connections with loved ones and create more supportive and understanding relationships.